Hi, YouTube. Welcome back to The Spark is Love. I am so happy you could join us. This month, we're going to be talking about mental health, and we have a beautiful guest that I am going to welcome in today. Her name is Jezel Rosa, and she is a mental health nurse practitioner. Welcome in.
Hi, welcome. Thank you for having me, Casey. I'm very happy and excited to be here.
Yes. Thank you for coming. I just want to put out a disclaimer first before we get into conversation. You have an amazing YouTube channel. Would you mind telling us a little bit about it?
Yes, so my YouTube channel is called Levelheaded Mind, which is also the name of my private practice. And it's about basically educating the public on various mental health topics. This month, I'm focusing on mental health awareness, of course, because it's Mental Health Awareness Month. And so I'm doing some interviews with different practitioners and people in the space of mental health.
Mhm.
However, I typically focus on mental health care treatments, different medications, and things that doctors and practitioners don't have a lot of time to share with their patients. You'll find on my channel, so that way they can make an informed decision about about their care and about their treatment.
Beautiful. So I'm putting all the links to her channel. It's gonna be in the description box below and it should pop up to the top. But let's get right into this interview. You mind telling us a little bit about yourself, who you are, what's your professional background?
Sure. So I am a psychiatric mental health nurse practitioner. However, I started my nursing career back in 1999, and that's when I got my licensed practical nursing degree. And I
Mhm.
guess it really started before then because when I was young, my grandmother had to move in with us because she had a stroke.
Okay.
And so I cared for her and helped my mom care for her. And she was the one who I was 12 years old and she told me, and she went like this to my nose after I was reading her a verse from the Bible. And she said, you'd make a really good nurse. And I said, really? But it stuck with me. And in my last year of high school, the vice principal actually put me into a work study program where I did half of the school day. Me and another student went to the hospital to work. And so I really started out then and worked as like a candy striper, like a nursing assistant role. And then that is what really opened my eyes to nursing. Then I went back to school at that time to get my LPN. And I was an LPN for many years, for about 13 years before I went back for my RN. And going back for my RN was actually a journey in and of itself because I was living in Pennsylvania at the time, moved to Florida, and it was in that transition of moving that I realized that the LPN role was very limiting. I moved to South Florida, as south as you can go down to the Florida Keys, and there weren't many opportunities for LPNs, at least at that time. And so it pushed me to go back to school and become an RN. And in that journey, I started to reignite this passion that I've always had for the role of nurse practitioner. However, I didn't really know I wanted to be a psychiatric nurse practitioner until like those last 5 years of my RN career that I really started focusing in on mental health care and opening up my eyes to the needs, especially down here where I live. There are very limited resources for mental health. And I was working at that time at a crisis stabilization unit and seeing a lot of patients coming in with mental health ailments and needing help and having a lack of resources, but being put on waiting lists, etc., in order to get that help. And so that was the push for me to go back and become a psychiatric nurse practitioner. And so here I
Wow.
am.
Well, here you are. I really appreciate you taking us on this journey with you, because there are a lot of people who realize that there is a great need for help in the space of mental health. And it's beautiful to see nurses such as yourself really leveling up and scaling up in your credentials so that you can help more people in just more of an in-depth way. About you have big ideas for the community, you have big ideas for mental health. What would you like to see in our communities?
I would like to see the resources open up more. One of the things about my practice is that I don't accept insurance. And people may think that that is a limiting factor, and actually I'm closing up a resource. But in fact, that's not so. Insurance has a lot of limitations on your practice, especially with the pay. When it comes to nurse practitioners, they only pay you 80% of what they would pay a physician doing the exact same role. But not only is that something that is demeaning in and of itself, but it creates this environment where now you have to see so many patients back to back to back in order to make up for that loss financially and in order to keep your head above the water in your own practice. And that's why when you go to a doctor's office, you'll see the waiting room is backed up. They're waiting to see the doctor. When you finally get to see the doctor, you're in there maybe 10, 15 minutes at best with the actual physician or psychiatrist. So when I looked at that model, I said, I don't want to be a part of this model. I want to break the mold. And the one way to break that mold is to not accept insurance. However, I understand that that limits a person's ability to see me. And so in one way of helping to decrease that or open the availability of the resource is to do what's called a sliding scale, which many private practitioners offer. So another way that I find very unique and what I plan on doing is taking the YouTube channel that I've created, and once it becomes monetized, taking those profits from that channel and funneling it into a fund to help patients who do not have the resources. So there's an application process and there's guidelines for people to be accepted. But once you're accepted, then you'll be funded for 6 months up to a year. You would choose the option depending on your current financial situation, how much you're going to need of that resource. And then that fund will be sent to the practitioner of your choice based on a referral network, which I'm currently building. And so basically, it's going to open up access to mental health care resources without using insurance, without using government funding, with using social media, with using people like you, clicking the like button, hitting share, subscribing to a channel. Here is a resource that we can use together. We can use social media and use it for good, which is increasing access to mental health care services to those who really need it. And so that is the goal ultimately. So no insurance, but in the end, I will be increasing access to mental health care.
Yes, and I have to hop in because I am your girl on the insurance. I have teamed up. I've been actually working a holistic model because I work with a medical cost sharing, and it's the same idea with primary care where the primary care physicians, they said, we don't want to give this rush care anymore, and no one is really winning or benefiting because we can't fully do what we want to do, and then our reputation goes down, but we're just trying to meet the quota. So let me just stop. I'm just going to reverse a little bit just to break it down. So we are under a system where people think having your insurance cover your services is a plus. But what you're breaking down to us is you're saying, wait. insurance actually, they set the pace, they set the standard of the services that I give. So as a practitioner, I cannot give you what you're needed. I have to give what I am being paid for. So you're taking that middleman out and you're saying, listen, I want to serve you based on your needs, not just payment.
Absolutely.
Am I getting that correctly?
Absolutely, 100%. Yeah, it's not just the pay, which is minimum that insurance will pay for the services, but it's also the limitations. It's also the
Mhm.
documentation, the time that you have to take to meet those standards in order to get paid, and then go back. And if you get a claim denied, all the time that it takes to try to amend that and correct it so that you do get paid. So there are claims out there that you may not even get paid for because your documentation doesn't support what they think
Mhm.
should be for that visit.
Mm.
So it's like they want you to either prescribe a specific type of medication or do a specific type of service for X, Y, and Z diagnosis.
Mm.
However, like you mentioned with holistic care, there are other ways of treating those
Mhm.
diagnoses, and pharmaceuticals aren't always the answer, and neither is the treatments that they will say are appropriate for that, because there are complementary and alternative types of
Mhm.
treatment that can be just as beneficial but are not covered. And so if your model is integrative as mine is, insurance will not pick up those types of treatments or services and they would be declined. And so the patient would end up paying out of pocket anyway for the service.
That brings me to this point that I really want to talk about. Now, there is a huge disparity in the Black and Brown community when it comes to mental health. And most, it's already a struggle to even acknowledge and recognize that we are in need of mental health, much less paying for mental health. So by the time someone really recognizes, hey, I have a problem, maybe they're in the hospital and they're being seen by practitioners there, and now what would you recommend for them? What Because I'm just trying to be real here, and the people who are end up on these Medicaid or these poorly funded insurance companies that cover mental health, usually these are the people who need it the most. So what are your thoughts on really reaching out to these communities proactively and holistically? What are some of your thoughts?
That's a good point to make, Casey, that there are a lot of people who, first of all, have the stigma of mental health care. And then when they finally realize that they need the help, they have these barriers. And one of the things is that, yes, if you have Medicaid or different insurance companies and you're thrown into the system, which is basically what happens, you get pushed into the system. And, if you've ever taken part of it, you'll know exactly what I'm talking about. And that's unfortunate. However, I want you to know that that's not the only way. What I would do is to go beyond the Medicaid, Medicare, whatever insurance that you have, and look at other providers. Specifically, look for private practices that are operating without insurance, and give them a call and let them know your situation. I can tell you from experience and from like dealing, working with colleagues in similar roles in private practices, that we do pro bono work. We do take patients, depending on the case, the situation. Like I said, we have sliding scales. A lot of us have sliding scales, and a lot of us will take a patient on pro bono to help them out if they're having a financial, hardship. And so don't feel like you're limited to just the Medicaid or whatever insurance that you have. You have to think outside the box, and you have to go beyond the standard of care. And think about it like this: if you can buy a cup of coffee a day, you can set aside enough money for mental health care. And so even if you fall on that sliding scale of, say, you're having to pay 40% of the cost, if you just learn to put your priorities straight, and instead of buying that cup of coffee, that frappuccino, or, God forbid you're buying cigarettes, that would be worse. But, if you just take that couple, $3 a day and put that aside, you'd actually be surprised the savings that would accumulate, and also be surprised that you could afford really good mental health care.
Now, I have to jump in there because I am a holistic nurse, and something that I have been advocating and talking about, and I think a lot of people don't see the connection between your physical and mental health and your financial health. So a lot of people say, well, I can't afford that. Oh, I have bills to pay. Oh, I got to show up at my job. I can make that trip to see her, or I can buy out that time or carve out that time. But you, in your practice, what happens to someone if they don't receive adequate care? So you are maybe you're not in crisis just yet, but you're really close to crisis. How does that affect every other part of their life? Why should they really prioritize not just getting help, but getting adequate help? What is the repercussions if they don't prioritize?
That's a really good point and a really good question. I believe firmly that mental health care is the foundation of all health. The reason I believe this is because I had my own experience with a mental health crisis where I experienced burnout that led to PTSD and severe anxiety. And that's a story in and of itself. But I intellectually knew that there's a connection, and know that there's a connection between mental health, inflammation, chronic disease, and poor health. However, I wasn't practicing what I preach. I was telling my patients all of this and giving out these resources, but I wasn't taking care of myself like I should have been. And it ended up being a detriment to not only my mental health, but also my physical health. When your mental health fails and you go into, whether it's burnout, whether it's actually a mental illness such as anxiety or depression, you create an inflammatory process in your body that's prompted by cortisol, because the sympathetic nervous system becomes overreactive, and it eventually gets to a point where it can't keep up. And this can look like blood sugar dysregulation, which can end up, with diabetes. It could also lead to poor eating habits. A lot of people with anxiety and depression will either overeat, and because they're trying to satisfy or get some dopamine, so they'll be eating a lot of carbohydrates, sugary foods, processed foods to try to pump their mood up. And others will not eat at all because, especially if you're into a deep depression, your appetite will actually be suppressed. Or if you're in a chronic state of anxiety, the acute phase, you're eating more than usual, you're stress eating, and then the chronic phase, you stop eating and you go into depression. And so your eating habits change. That can lead to extreme weight gain or weight loss, which is also not good for your health. And it predisposes you to many diseases. When you have this high level of cortisol, these inflammatory markers and cytokines become activated in your immune system, which is basically all over not just your brain, but your entire body. And so you can become susceptible to many diseases, such as fibromyalgia, which is very, very common with patients who have PTSD, trauma, and anxiety. And you can also have issues with your heart. Heart disease and depression are commonly linked together. And so there are all of these connections that we can make between mental health and physical health. Also, gut health. There's a gut brain connection, and it just goes on and on and on. And so when you're not taking care of your health, your mental health, everything else goes to the wayside. And this could take weeks, months, or years. And when a person doesn't put their mental health priorities first, it eventually will show. It'll eventually will come out and show in a way that your physical body then begins to, whether it's pain, whether it's vomiting, diarrhea, a lot of symptoms will start to show the manifestation of that poor mental health.
You know, I've been reading this book, When the Body Says No by Dr. Gabor Mate, and he says his findings, his research is spot on to what you're saying. And when you go to the doctor, they don't say, how's your mental health? They don't make the connections for you. They just treat the problem. If you're diabetic, that you get on a regimen, and the connection is not always made. And I'm not saying that the doctors are bad. It's just part of the system. It's broken. But I really thank you for having this real conversation with me. You are an excellent, excellent educator. And the things on your channel, the topics you talk about, the medications you really break down. If anyone is struggling with mental health, or even they sought a practitioner, maybe it's not the best visit that they wanted, they can also use your videos to supplement their understanding. And even on your channel, I have noticed you're even reaching out to your viewers and say, let me know. Tell me what you want to talk about. This is a free resource, y'all.
Absolutely.
I just gotta say, that is amazing. Like, who does this? And to hear your plans and to hear where you're going with this and how you intend to serve just so many people through YouTube, through social media. You have my heart. You have my heart.
So, thank you so much, Casey. I really appreciate you bringing mental health awareness to others. And certainly, yes, if people have questions about their mental health care journey, hop on my channel, put it in the comments, and I will definitely get a video done on that topic. I've got my list going and I'm knocking them out. So definitely my goal is to help you all on your mental health care journey so that you can have a better mental health care experience and a better understanding of what is going on with your mental health care.
Beautiful. That's just beautiful. I want to thank you so much for coming on my show as a community nurse. I think, especially as nurses, we have a special bond, and just to be able to be on social media, working for ourselves and talking about real topics, real issues, it is just so beautiful. So I thank you so very much for coming on.